Welcome to Dateline Health. This is Fred Lippman coming to you from Nova Southeastern University, and we're here at the Alan B. Llewellyn Innovation Center, which is a effort between Broward County and Nova Southeastern University. We're very pleased to be in the center. We have I think, a very timely subject area. As I will tell my guests, we've been doing this now for almost 23 years, and this show really belongs to the people that watch the show, so they ask questions. And one of the biggest questions that, multiple questions that come our way relate to really, I guess, the issue of what the insidious pandemic has done to the general public, the society, and the delivery of health care. And knowing that both of you, both Cathy Bowers, with multiple acronyms after her name, and she's the president of the National Patient Advocate Group, and we have Ms. Ann Llewellyn. You have multiple acronyms after your name also, and you're a nurse advocate, a blogger, whatever that means, and we'll find out, and have a digital journal. So I just thought, since we have a lot of people, the questions, the programs that we've been doing now for almost 23 years really are driven by questions that come from our viewers. And people are very confused, at least that's my evaluation, as to what they can do to ask questions and how they can get through the morass of, I don't want to say bureaucracy, but the almost untenable need for information when one is cared for. So I'm going to give it to you, and I'm going to start with Cathy F. Bowers. And Cathy, welcome. You're the president of the National Patient Advocacy. Go ahead.
Yes. Hi, good morning. I have been involved in my journey with my company for about 12 years. Prior to that, I was a director of a guardianship program for a nonprofit in Palm Beach County. Unfortunately, 2009, the program got terminated, and I looked around and I said, well, what do I enjoy most about my work as a guardian? And it was patient advocacy. And like many other people, I had the experience, unfortunately, of working with family and friends for about 25 years, helping them kind of navigate the system. So that's how I got involved and launched my company.
Okay. And Ms. Ann Llewellyn, let's hear from you.
Thank you, and good morning, everyone. I'm a nurse myself. I've been a nurse for over 40 years, critical care background. And I really always thought that I knew about the healthcare system and could manage the healthcare system. I would be the person everyone in my family would come to when they had a problem. Until 2014, and I had a health issue myself. I was diagnosed with a brain tumor, and it thrust me into the healthcare system. And my husband was my advocate, and I was lucky enough to have two people. Cathy Bowers was one of them, and another friend of mine, Marilyn Van Houten, who was a colleague and a case manager. And they helped me navigate the healthcare system. They helped my husband understand what to do, how to help him ask questions that he needed to know answers to. So based on that experience, after I got better, thank God that chemotherapy was able to take care of the tumor. I switched my focus, as Cathy did with hers, to really focusing on nurse advocacy, being there to help people navigate the healthcare system, ask those tough questions and get answers from their doctors, from the nurses, from the therapists who are involved in their care. And they want to do that. They do. But most people are kind of intimidated sometimes when they go into the healthcare system, and they are afraid to ask a question. But our roles are to advocate for people to ask that question. When I'm at a doctor's office with a patient, and I know before the appointment we talked about what we were going to ask the doctor, And we were sitting there and we didn't ask the doctor the question. I say, John, I thought you wanted to ask the doctor a question. Oh, yeah, I did. And then he asked the question. And it's just amazing as people work with advocates to see how they change and they become more empowered and they are able to ask those questions. So that's what our job is to really empower the patient, empower the family to ask questions, because, you know, the doctors and everyone else in the healthcare team want to help patients, but sometimes they don't know what the patient's wishes are fully because the patient didn't express them. So that's our role, is to help people communicate better and collaborate better.
The people are no different than the people who are caring for them. We're all human beings. And the only way that we would normally talk to somebody, if we were going to walk into, I mean, I may get oversimplistic, but we were going to go into a restaurant. We get a menu and we ask questions. Could you make it a little rare? Could you keep the onions off? Don't put any butter on. We're attuned to knowing what happens, or we ask questions. In healthcare, a lot of people have never gotten into what I would call the tertiary care system of healthcare. They're not used to going to the hospital. They're not going to the super subspecialists. And I would assume that both of you, as advocates, in quotes, of the patient, you have to deal with this in two ways. Not only because people have mixed knowledge, but also we recognize that here we are living in a venue called South Florida, dominantly, where we have the highest number of people over the age of 70 of any place in the nation, and we have the greatest percentage of people over the age of 85 that live in any place in the nation. So it's really unfair to say to someone, well, you know, do you know how to use a computer, all right? Do you have a computer? You see where I'm going? Let's start out with you, Cathy.
Okay, great. Perfect. I had a client, 34-year-old gentleman, call me from West Palm Beach. He was brand new into the Marketplace Affordable Care Act. He had no skill set, no experience. He lived at home with his parents. He was working remotely, and he had a medical issue. He was on an HMO, and he went to a urologist, and they set up a procedure for him in the neighboring hospital across the street. Unfortunately, he got like a $3,000 bill because they said that the hospital was out of network. So on the surface, one would say, where are the authorizations? I'm sure most of us are familiar when we go into an outpatient to get a colonoscopy, or you're going into a new physician's office, or even to the ER, you're asked to usually give your insurance card, your driver's license, your demographic information, which he did, but he didn't know that it was going to be out of network. So the bottom line was there was a lack of communication. I isolated it to the practice scheduler in the office, who said, oh, yes, we did our job, but the hospital didn't follow through. They didn't give him a call to make sure he was authorized. End of story. I go up the ladder. I get to the corporate level of his insurance company. I get with a what's called a QIO, a Quality Improvement Officer. She talks to me for 3 minutes. We got the case settled, and he did not have to pay that amount of money. So you're right. My job with Ann and most of us, I want to teach you how to fish. I want to give you information that will help you go through your journey, and of course, reduce medical errors. And let me say one thing that I'm very adamant about. Every time you go into a facility, whether it be a hospital, outpatient, your physician's office, you are generating, when you give their information, what's called a face sheet. I think in California, it's called PIRS, Personal Information Record. I always suggest and that everybody ask for a copy of that one-page sheet that's being generated. As a guardian, I can't tell you how many times I got woken up in the middle of the night by a nurse saying, "Oh, we have to do an emergency procedure. We need informed consent." I said, "Excuse me, Nurse Jones, I spoke to the doctor like 4 hours ago." "Oh, well, I'm sorry, Cathy, we couldn't reach you because your number was incorrect on the face sheet." So that's case in point, to make sure that everybody has the ability to request it, and make sure you check it for accuracy. So we don't want anybody to be treated without informed consent in a medical situation.
Anne, what do you have to say about that?
Yeah, what you said about the older person navigating the healthcare system. I had a woman who was 95 years old who I was a nurse advocate for recently. And the reason I was her advocate is because her two sons lived out of state. And she was having a very serious problem. She was having a GI bleed, and the doctors could never find the source of the bleeding. So she was continually going in the hospital, having transfusions, coming home. She'd be okay for a day or two or a week, and then her blood count would drop. So the family couldn't keep coming to South Florida. They had to work. So they decided, we're going to get an advocate. And I was called because I lived in the area, and they found me, and I worked with this woman, got her to the doctors, went to each of the appointments with her, found out that, we got to get a specialist to think outside the box here because we can't find the bleed. And we took her to Cleveland Clinic, and the doctor there remarkably was going to do an upper and lower endoscopy, which would have been, he was afraid to do it because he said, "She's so old, I'm afraid to put her through this." So he decided he used a pediatric colonoscopy tube, which was thinner, longer, and could pass through the stomach, go into the duodenum, which the other scopes couldn't reach, and found the bleeding and cauterized it. This woman turned around and did wonderful. She had at least 6 more years of her life. And she was awake and alert, oriented, and I learned so much from her because she was an older woman, but she was very alert as to what she wanted, who she was, and she was very good at talking to her doctors. So I would sit in the office with her many times with doctors, and she would be very friendly with them, and they would joke, and it was really nice to see her communicate with her doctors. But there were times when I had to step in and ask a question, but I mostly just let her talk. So I do agree with you. The system is difficult for the elderly population, but we can't underestimate them because they do have thoughts and wishes and goals, and we need to help them talk to their doctors about it. Many times the doctors would look at me when I was there, ask me why we were here, and I'd turn it right back to say why we were here, and she would pick it up. So as far as using the computer, maybe that's why I would be her advocate. She didn't like the computer. She didn't like the iPad. So I would get the emails, and then I would call her and talk to her about it. We would make a decision, and I would follow up. So this healthcare system is challenging today. I always say the healthcare system is built for the healthcare system, not the people who use it. And our job as advocates is to help those people use it more efficiently and effectively. And it's maybe doing that. Now we all have patient portals. Some of us have multiple patient portals that contains all of our information that we can access. My patient, she would never go in her patient portal, but she gave me permission to go into her patient portal. So I could go in, get records, make sure the records at one doctor got transferred to the specialist who was going to see her. That was my job as the advocate. And that's what I was able to help with. Improve care coordination, improve communication, that everybody was talking off the same page.
Yeah, and let me step in. I'm sorry, just quickly. Dr. Lippman, you mentioned about the pandemic. Absolutely. If I think that it was difficult for me to sit on the phone and try to reach a discharge planner or the risk manager or the nursing supervisor at 3 a.m. because a client would call and say, I'm calling the phone, the unit nurse desk, and it rings 25 times. No doubt that has put a tremendous extra burden and strain. I put a little sticky on my computer to remember to say thank you to all the people that help us. And as a side note, when I was a guardian occasionally, and I'm up there just giving, I seem nice and pleasant, but I will be assertive and keep going. I climb till I can't climb anymore to get to the right person. I always would take a laugh when the doctor, the nurse, we'd walk away and they turn around and wink at me and they said, Cathy, I so much appreciate the work you're doing. I wish I had somebody like you from my Aunt Phyllis in Chicago last year.
There's a lot of problems that are inherent to the hospital systems and to the healthcare professionals who are trying to do the very best that they can do. But, you know, I don't really think we can get to an answer by me just asking you these questions, but I want people to understand that their own responsibilities, with all due respect to your advocacy unit, I want them to understand that they just shouldn't be signing things without asking oversimplistic questions.
Yes, they do. It is a responsibility of each of us for our own healthcare work. As Cathy said, to get the face sheet. I actually just got a patient I'm working with right now, and I was looking at his face sheet because we had to go to the doctor's office. And there is wrong information. It says he's divorced. He is not divorced. He's has a significant other. And her name wasn't even on the face sheet as a contact. So there's things that are missing. And it, as you say, it's because of the system. People go through it, and if they don't know they don't know the answer, and the patient might not be there, they tab through and put N.A. or they leave a blank. We need to fill in that information so it's there so people can be called when there's an emergency. So just that simple act of asking for the face sheet. And when you ask for it, and Cathy, I'm sure when you've asked for it, when I've asked for it, why do you need that? Well, we need it to make sure it's correct, because often it isn't correct. And that's the time to correct it, when you're sitting in front of a person who has it up on the screen and can review it and update it, because things change.
Well, what I'm saying is that you know, you're at the level where you have the advocacy and the ability and the knowledge of what to do. But, you know, someone comes on a, you know, it's 911 and they're brought into an ER, et cetera, et cetera. I understand the terror, the horror, the feel of people at that point in time. But the people who end up going into a predetermined hospital visit, what I'm suggesting is that, and just a suggestion, I usually leave that to the viewers and the people who are on the program, such as yourself, but you know, you need to have a sheet of all the medicaments and the supplements that you're taking.
Yeah, you're 100% right, Dr. Lippman. Case in point, recently, my own family situation, my sister lives in California, and I received a call on my cell phone from an EMT. I said, how'd you get my number? Well, it was the last number dialed. She was in an emergent situation, and they found me, so I had to get scrambling. 100% right. I encourage everybody to have a grab and go kit. I think everybody, please go home tonight or this afternoon, make a Xerox, a copy of your driver's license, your health insurance cards, whatever it is that you have, and also a sheet of people to contact, as well as, yes, your medical medications. And even you can go so far as to have a medical biography. I have a 6-page medical biography that I'm ready to go if I need be, which leads me into something that's very important about making sure that we all have advanced directives so we have capacity to make decisions about our own health care if we can.
Yeah, the more prepared we can be, and we teach this when we talk to people. Yes, have your list, have your doctors, all the doctors' names and phone numbers, all your medications on a piece of paper. You can store it in your computer, you can write it in a copybook. But they're the things that you're right, Dr. Littman. The healthcare system is at a loss if they don't know anything about you when you're wheeled into the emergency room. And your family may be there, but they might not know. If you don't live together, they don't know what your latest medications are. And so being prepared, and that's what we do as advocates, is help people to be better prepared to go into the healthcare system so it isn't a nightmare. It can be a good experience. And I do agree with you to ask any question. Patient advocacy, I always say, is a lot of common sense. It's what you want to know. What is wrong with my mother? What will we do to fix it or to address it? Where will we do that? And they're the things, the basic questions that everybody wants to know. Write them down, because in the middle of everything, chaos, you forget things. So have a notebook, have a copybook with these questions on it as you're talking to the doctor. Some doctors and nurses and other healthcare professionals, they're in a rush. But if you say, look, I'm just trying to understand what's going on, can you just help me? Most people will stop and sit down with you and talk to you. And we really want people to advocate for themselves. Most people don't need Cathy or I to be in their lives as advocates. They can do it themselves if they're prepared. And there are organizations like a project that we're both, Cathy and I, are involved with, that has a number of checklists for people to use to be able to understand what's going on in a more organized manner. So we can give that as a resource if people, who watch this are interested.
Well, I don't make to be oversimplistic, but you watch television or you read newspapers, and of course, not that many people read newspapers anymore, but whatever it is. But there's always preparation for hurricane season, all right? Always preparation. What do you do with this? What do you do with that? Take pictures of this. Make sure your jewelry is in a safe or whatever it is. But yet, and again, this is not necessarily centric to individuals who have illnesses. You talk about the child that comes down with 104 temperature, that all of a sudden you have to call, or you get to the ER, you have to call the pediatrician. But how do they know, for example, what you bought in the grocery store or in the pharmacy prior to that, unless you tell them? Yes, it would be my object to answer the questions of the people who ask the questions of the program, to tell them there are people such as yourselves, but not everybody has an opportunity to get to a Cathy Bowers or an Ann Llewellyn. All right, they really have a mom or dad or a husband or wife, significant other, or whatever, and really they need to be prepared just like they would be prepared for a hurricane. Is that oversimplistic, or do you see what I'm saying?
No, it's perfect. It's great advice, and we stress that because, again, we're not everybody has or needs an advocate. You can be your own advocate if you're prepared, and just taking those little steps today, as Cathy said, as soon as, right today, start that list, write down all your doctors' names, their phone numbers, what kind of doctor they are. Could be just the heart doctor, the foot doctor. You don't have to know their formal names. And then their phone numbers, where they're at. So if you bring that information into the ER, the staff can utilize it to find out about you. Where do you get your medications? list all the medications and supplements that you take so everybody's aware.
We're down to the last 2 minutes of this show. I don't mean to interrupt you, but Cathy and Ann, if I might, you don't mind me calling you by your first names, I just want to stress to the people that they need to be prepared. I've seen the pressures that are in the hospitals and in the medical offices during this insidious pandemic. I just hope that the people recognize that what you're saying is not limited to just your advocacy. They need to instill within themselves a sense of advocacy that enables them not necessarily to be you or Cathy, it's for themselves.
Right, definitely. Definitely.
100%. 100%.
100%.
So, Cathy F. Bowers and Ann Llewellyn, we want to thank you very much for your advocacy, because it's really a blessing. I know the willingness to help other people is not always the object of necessarily our entire population, but I always believe that the good human spirit is there, and all you have to do is just tickle it a little, and it's going to come out. And I think the advocacy that you're both presenting requires individuals to do certain tasks. And I thank you both for caring for people, because they are people with perhaps less knowledge, or individuals who are very, very smart that don't believe that the system can get them, all right? And yet we have magnificent physician healthcare providers, wonderful nurse professionals, wonderful people that are trying desperately to make their care pleasant and successful. Thank you both very much for what you do. This show is called Dateline Health. If you have any questions or anything, just right here. My name is Fred Lippman. Until next time, see you.